Please welcome your panel on Unlocking Health Data, moderated by NBC anchor Richard Louie.
Room emptied out. All right. Oh, God.
Sitting in the chair that Dr. McDreamy sat in.
Well, Milken, we were thinking backstage there that we would change the name of this panel to Making Data Dreamy. We decided we better stick with what we were told to do. It's so great to see all four of you. But, I am going to start with asking you what made or does make data dreamy to all of you in your respective positions, your respective perspectives. So I'll introduce each of you one by one, and if you could describe what you do, and then why is data dreamy to you? And so Raman Bastani, CEO of Healthvana, we'll start with you.
That sounds great. Thank you for having me. So maybe I'll start with the second one first. What makes it dreamy is that, so my story is that I took care of my father for a number of years before he passed away from lung cancer. So a lot of what McDreamy just said really resonated. And so if we would have had the tools like AI today, at that point, it would have made things so much easier for our family, especially because we immigrated and English is not the first language. So that would have been incredible. So Healthvana, a company that most of you have probably not heard about, we've helped tens of millions of patients across the United States help get access to their information. We digitize a lot of what's happening in healthcare, and we've been doing it for about a decade. A lot of our work today focuses on AI. Some of our customers are the County of Los Angeles and others, but that's a little bit about us.
That's fantastic. David Feinberg, Chairman, Oracle Health, one of our medical doctors sitting up, one of our MDs, right? That's sitting on the stage today. Go ahead.
So I just play a doctor on TV. So I don't think that data is dreamy at all. I think what's really dreamy is people caring for other people. And it's based on trust. And whether that's you being a caregiver, whether that's you being self-care for yourself, or a professional caregiver, your goal is to really establish trust and help people get back on track, back to what they like to do. And the data piece can be very helpful, but I think sometimes we put the data piece first when really it is simply a tool to allow that caregiving, that human-to-human interaction really prosper. The more data that I have, if it's in my workflow and can help me provide better care for you, that's great, but I think foundationally we're talking about people caring for people.
So you're saying it's not always dreamy. Sometimes,
that's right. Sometimes it's a nightmare.
It's an overfocus. Yeah. Deborah Kilpatrick, partner at Sonder Capital.
Yes, thank you for the question and the chance to be here. I'm an early stage med tech and health tech investor in Silicon Valley, and I would say it's pretty rare at this stage of where we are in technology and in product development in those spaces that there is not some aspect of data that is really important to how that product performs. But what makes it dreamy for me, as a consumer and patient in the system myself, is when my data is accessible to me. It is liquid and accessible to me, and the incentives are aligned for me to contribute and use it for not just me, but for maybe other patients like me. And I'm sure we'll probably get into that more and more.
Our other MD on stage, Han Pak, Senior Vice President, Head of Digital Health Team, Mobile E-Experience, Samsung Electronics. To you, my friend.
So it's great to be here. It's hard to follow Dr. McDreamy, number one.
Yes. I must tell the audience you actually wanted a picture with him.
Yes.
Yes.
But he didn't stop by.
He was being mobbed before.
I'm hoping that there will be a mob waiting for us as we exit stage. Anyway, given my role of what we're trying to do of connected care centered around the home, we talk about connected devices and the data, connecting people to each other, which brings humanity into this picture, and then connecting the services in a way that makes healthcare simple. That's really what we're after. And so what makes data, in some ways, dreamy is in part, I think data is necessary, but insufficient to get to where we need to be. And this is David's point. But what I'm excited about is if we use that and liberate it, not control it, but liberate it and bring people together around it, I think there's some amazing things we can do together.
This is fantastic. And all four of you, we're going to dig into the data, what we have, what we don't have, what we need to go after. Second of all, we're going to look at how do we use the data, how should we use it, and how are we using it. And then finally, the commercialization of data. What are people paying for this? What should they be paying for? Should they be paying for it at all? Deb, I want to start with you on this. Talk about data, that first bucket. What do we have? What do we need to get in that data segmentation?
So we have a lot. The opportunity is that we have multi-omic data. We have contextual data about what's going on in our daily lives around us and our choices and our behaviors. We have many, many forms of digital data that reflect our health that are being generated every minute of every day from watches and phones and all kinds of consumer devices that Samsung and many other companies like them are allowing us to have in our daily lives. I said the challenge is not that we don't have enough data in some ways, it's that it's not linked. And it's not in a linked format that's accessible to product developers and at the API or SDK layer to get technical about it. That allows it to be used for product development. I think the second opportunity that is also a challenge is look, we're in a moment where medical technology in particular, and med tech devices and class 3 implantables in my world in particular, are now in a loop where my own patterns of response to the therapy delivery can be used to tune the therapy to make me better on my terms.
Real time?
Real time. And now this is very early,
right?
But we just had a paper published in the Parkinson's space in August of 2024 that in some ways the most exciting part of it was not just that this particular deep brain stimulator implant is now using AI to tune algorithms to an individual person. In some ways, the most exciting part of that paper, if you read sort of beyond the abstract in this experimental study by the NIH, is that patients themselves could go into adaptive mode by pushing a button on their phone that allowed them to be in control of when the AI algorithm would take over. Because if my meds are working, maybe I don't need my implant to do anything differently. But if I can feel that my meds are waning and that my symptoms are no longer quiescent, maybe I could use a little help from my implant. And so we're in a moment where all the data that is possible to be generated from a med tech perspective is that we're at the dawn of just scratching the surface of allowing that real time to help that therapy be tailored to me. That is incredibly exciting. And so in all the talk about data not being fully liquid and not being fully accessible and where the gaps are, I want to be mindful of pointing out that there's some amazing things going on, and we should be really glad about that as patients.
David, is it really exciting and amazing right now? Depending which investor you talk with, they will be taking their AI, if you will, portfolio, and they'll be investing it into data, not necessarily new LLMs or AI apps or wrappers. They're going after the spaces that we haven't seen yet. What's the conversation at Oracle Health like?
Well, let me actually, Richard, add on to what Deborah said, because I think it laid it out perfectly. So, and it is the kind of strategy we have at Oracle Health. So for health outcomes, most of the data is not in your electronic health record. It's this other information, your zip code, your genetic code, your behavior, what side of the street you live on, your neighborhood, your loneliness, right? That isn't captured in the electronic health record. So we're the largest electronic health record company in the world. And when we're done with the VA, we're again the largest in the United States. And what I say to the team is that means we have more of grandma's blood sugar than anyone else, okay? So now we have that. What do we do with it? Well, I need to know so much more. What's going on in grandma's cupboards? What's going on with her feet and with her eyes? Who's taking care of grandma? What's happening with her medication, right? It starts bringing all these questions.
That's right.
So for our electronic health record, to kind of get to that one piece, we've increased our open APIs by 300%. So the innovators of the world can read and write into it, because if you actually ask doctors and nurses right now, they are burnt out because we've made them data clerks, right? So this AI can certainly help write their note. I got an email today from a doctor at Vandalia Health in West Virginia who started using our clinical AI agent, which helps you write your note. And the doctor wrote that...
It helps you write the doctor's note?
It helps, well, it's pretty amazing. You go in, you say, tell me about your next patient. It tells you about the patient using AI with permission from the patient. It captures the conversation. You can even say in the middle, hey, Oracle, what was the last time happened when I increased the metformin? And it tells you. And then at the end of the visit, with a human in the loop, it writes the note, it does the prescription. Basically, you see your doctor, and the doctor never touches the computer. So one of the docs who's using that wrote to me that he's been now using it for a month, and he's always worried about his health, but he's never had time to eat lunch without charting, and he's not mindful when he's been charting. But now that he's been using this, he's been able to not only eat lunch in a half hour and then a half hour to exercise. He's going to the Y after work, and he's lost 8 pounds. So it's actually helped the doctor with his health by taking all this burden, and it's the same side on the patient side. So instead of sending a patient a reminder, you have an appointment at 1 o'clock next Wednesday, press 1 for yes, 2 for no, 3 for change, that patient can write anything they want. I got abnormal vaginal bleeding. I'm worried about vaccinating my kids. I need the blue pill. I need my metformin increased. All of the AI allows that to happen in a way that you get a sense this health system knows you and has been expecting you. So pretty amazing when you talk about the AI, but the real excitement is going to come from the innovators that sit on top. Now that we've taken the burden off the clinician or the individuals, to be able to give you the nudge, to be able to give you the right idea about what can come next. I mean, theoretically, we have the ability now to write out the rest of your medical record. So I could take a look at your record, or our computers, Richard, and tell you, here's what it's going to look like for the next 10 years. And we're about 90% accurate. It's kind of scary.
90% confident.
And it's going to say, kind of God forbid with you, you're going to have a stroke in 6 years, and you're not going to make it to your kid's graduation unless you get more focused on your anti-blood pressure medication, right? So those kinds of abilities are going to allow the human interaction to happen in a very different way. I don't think people want all their data. I think people want to know, what's my bad cholesterol, and when is my mom going to see the doctor, and did she pick up her refills? We want information that's helpful for us, that's based on the data. You can actually get all your data now, but it's in PDFs, it's unintelligible, it's duplicated like 90, if you ask for all your medical records, I had a biopsy on my arm, it probably says it 400 times in different records because they just cut and paste. So I need a longitudinal story about myself. To Hans' point, I need to know my lifestyle issues and my medical issues. I need that data together, and I need to make it actionable.
Hans, staying on data here, what don't we have? What do we have? And what's that balance, by the way, if the total sum is 100 in terms of what we have and what we don't have?
Not sure how to answer that question. I mean, you know, as we discussed, we have tons of data. If you look at, you know, currently available on our smartwatches and other competitors, you'll see heart rate variability that relate to stress. Pulse ox gives you oxygenation. Skin temperature that gives you ability to help with fertility, with menstrual cycles. I mean, the list just goes on and on.
In facility,
though.
Huh? In facility, correct? Or you're talking about?
Oh, this is on your consumer
You're talking about
watch,
IoT, right? Okay.
Right?
Right.
And then we have PHR data that we launched, and then we have PPG signals that we convert, and now we can tell you whether you have moderate to severe sleep apnea, as an example, or arrhythmia. Like, so the list is long. But I think to David's point, the problem isn't, is there not enough data? Clearly there could be more, but it's the linkage. It's really about what I see is that we're data-rich, information-poor, because I, as a physician, typically see a patient, I grab 1% of the data and I try to make the best out of my diagnosis and treatment and manage that patient. So I'll take a blood pressure once and assume that that is an average. In fact, that's not the case. It varies day to day, a number of things. So to me, what I would say is we have data richness on the consumer side now, on the lifestyle. We have tons of data that's being opened up. It's really how do you merge this data in ways that are actionable and within the workflow to make it easier. Because the problem is, physicians will say, well, you give me all this sleep data, activity data. I know it's important, but I'm busy just managing my data. And so then how do you bring that together? And so this is the old, when EHR first launched, it was really the workflow that we had to worry about to help understand and help support physicians. But
so you're saying we have enough, we're just not good at linking it.
We clearly could use more data in different ways, and that's just going to continue to grow. I think where the energy needs to be spent is how do you bring it together in a meaningful way that the patient can consume and understand when context changes on this side and vice versa. Because think about it, the biggest issue right now is we spend in the US less than 3% for preventive services. We have 25% of the healthcare cost due to preventable illnesses. Right? This is the mismatch. This is all about how do you really get individuals to change their behavior. So the data alone will not change behavior of individuals. It's about humanity. It's about context. It's about engaging.
Which we'll get to. Want to finish out this first part of our conversation here. Raman, do we have enough data?
Yes.
Okay, yes.
Yeah.
Is it 80-20? 51-49?
I think most people have all the data they want. And out of curiosity, who in the room uses OpenAI or just some sort of LLM? How many of you put your own health data in there already to figure something out? How many of you used Google before, Dr. Google, to figure something out? So the idea that people, these are all absolutely correct. We have a slightly different view than they do, and we've worked with AI now since it came out. It changes the game completely. Everything they're saying is true.
How long is that?
How long have we been doing
you've been using AI since it came out. How long is that?
Yes. So we launched our first version in 2023, late 2023, across 20 states. We have probably 100,000 patients using it inside of a portal. We're publishing on the data with Stanford and Dr. Nirav Shah to be able to show that it's led to better health outcomes. So we know the AI works. And the reason I bring up AI for the people in the room is if you're not already using AI to help with your health-related stuff, I don't know what you're doing. I'm not saying you necessarily put your own records into it. You can if you want. I certainly have. I'm interested in figuring out these things out. They've been more helpful than any doctor I've ever seen. They've been helpful to bring together different data sets that you all are already talking about and make it make sense. I don't think patients care about privacy as much as I think we're about to talk about. I think they care about one thing. Am I going to be okay? That's the only thing that matters to people in this room. Am I going to be okay? Is my kid going to be okay? Is my loved one going to be okay?
So they're less concerned about privacy and consent, is what you're saying?
Yeah, I mean,
still relevant. I'm just saying less than before, relative.
We have probably one of the largest data sets on HIV patients in the United States, so we absolutely care about privacy. But when we talk to people that are, a single mother, 2 jobs, kids sick at 11 o'clock at night, they're not thinking about the EMR, they're not thinking about their watch data, they're thinking about, is my kid going to be okay? How do I get some information? So Dr. Google will be replaced, and already is, by AI, and this is the most extraordinary shift I've seen in doing this kind of work. And from a personal perspective, it would have been useful. It's useful for my mom. We speak Farsi. She's able to go to her doctor now and actually speak into, she never uses any apps, but she speaks into this, and it comes out in the language that can help her understand what's going on.
Very quickly, and I'm going to get to, again, privacy and consent very quickly before we get into the next bucket is, so I'm getting the sense if you could raise your hand on the panel, we have enough? 51% or above? Is that true from all 4 of you? Okay, great. And now, privacy and consent, 30 seconds each before we move on. Your view on that challenge right now, right? Because if we have enough data, then how are we managing that? David, 30 seconds.
So I've had the opportunity to run a couple health systems, and when you go into a health system, they give you this 40-page paper called Terms and Conditions, and are you not going to sign it? So you have no idea what you're signing. And part of that is this business associates agreement that they're using the data for a lot of things, billing, the laboratory, the electronic health record company. I think if we don't have trust in healthcare, we end up really, really starting to fall apart. And to me, we have to explain things in a way that people understand. And when you do, people almost uniformly say, hey, can you keep my data safe? And if you can use it in a de-identified way to help others, I'm game. But they have to trust you or you can't get that done. And if we can use it in a de-identified way to help others, this AI stuff is mind-blowing.
Han, how do we de-identify? How do we create the trust?
Yeah, I think the de-identification, there are many different techniques on how to do that, and so I don't think necessarily I'm the right expert to tell you that, and there are appropriate ways of doing that. I think the question about trust is probably, as David said, the fundamental question for us as a consumer electronics company. We have a trusted brand in the home, right? 70% of the consumers in the US have at least one Samsung product. If we lose through this health effort what we do and we lose the trust, I've done major damage. So one, as a physician, the last thing I want to do is violate trust, because to me, you continue to gain trust, but you lose that trust, it's one mistake. And so to me, how we do that is with humanity, with the right intent of always imagining the patient and the consumer first, and putting ourselves in that position saying, are we doing the right thing? And that's what I'm accountable for. And I believe that, again, trust is just earned, and we have to do a set of things to get there, not it's one thing.
Deb, does this come down, when we're looking at trust as one of the inputs here to privacy and consent, does this bring more power to locality, to the hyperlocal, to the doctor that you see sitting across from you? But on the flip side, does it also say that there's a lot of trust power when it comes to the big brands that you trust, like Samsung that we're talking about, when it comes to consumer products? How does that come into play in your view on privacy and consent?
So the thing that I learned in the most compelling way, 12 years ago when we started Evidation, my last company, where we were doing really large-scale decentralized post-approval research for pharma, using many very large data sets that we would consent not only at the time of data collection, but we would reconsent at the time of data use, and this created a huge amount of trust. And the reason why this is so important in sort of the era that we live in now, and it was becoming important 10 years ago, is because we weren't living in a world of static data, episodic data. We were living in a world of streaming data. And in a world of streaming data, there's, in theory, an infinite number of data slices that could be used for any number of future data uses or analysis uses. And it was paramount that we began not just educating ourselves and our community and our clients, but educating our user base, our patient base, that there was a reason why we were asking them for consent again in the future and not just at data collection, because people weren't thinking about data in a streaming context at that time. And what we learned was that simple step of reconsenting for different use cases and not just at the time of collection, boy, did that create a huge amount of trust. And when you have trust, it's a currency.
Yeah, it
is a currency.
That's right.
And when you don't have it, it's a real consequence and loss.
Yeah, twice the cost to get the trust back.
Yeah.
Raman, most folks are using data the right way, whatever the right way is, or most folks are using it the wrong way, whatever the wrong way is.
I think they're going to use it for whatever makes the most sense for them. So if you're anxious, you're going to use it to look up your information on OpenAI or Google, whatever it may be. On the privacy question that you asked earlier, it's overblown. Absolutely, you want to do the steps they've been espousing. You want to do all those things. And trust, I don't think, comes from a brand necessarily. It doesn't come necessarily from the name of a huge health system. It comes from the experience. Does the patient have a good experience with the doctor? Does the patient have a good experience with the system? Or do they feel screwed over? Right? And if the experience on a technology aspect on your phone, if you use it, how many people download an app that doesn't work within the first 30 seconds and you just delete it and give up? Okay, so the entire room. So I think trust comes from experience, and you make it really simple, and that's where you actually build the trust, where it actually helps patients the way, and trust has to be earned over and over and over again. With our AI, for example, patients trust it in a way that has blown us away.
Okay.
They're asking about, they're talking to the AI. When we say, hey, do you want to talk to a physician? They say no. They're asking about things like suicide, which we immediately have a protocol where they're going to get a phone number to call right away. They're talking about things like, the most sensitive things you can possibly imagine they're bringing up. So the trust is being built by not having a terrible experience, is what we've noticed thus far.
For folks, I'm going to put up the QR code. Please, by all means, scan it, put in a comment or question. We're going to get to that in about 5 minutes. And so please do give us your thoughts or your questions. Second big bucket, as you can tell that I'm moving into here, is usage. And if each of our panels can stay within 60 seconds here, what is a good protocol that you have seen in terms of an organization, a business using data, either your own organization or others, that you think we should know about when we're looking at best practices in this space? Raman, I'm going to go back to you.
Organizations that have the best practice at this. I'm not quite sure off the top of my head who.
How about Healthana? What do you do?
Yeah, so with the AI piece, we have it inside the patient portal. Patients can utilize it. I can tell you over 8 years of having a patient portal with one customer that's across half the country, they had 60 messages back and forth with their healthcare provider. That's the number one out of hundreds of thousands of patients. That was the longest conversation. Within the first few months of doing the AI, you had people over 500 messages back and forth the AI. We just had someone go 1,200 messages in a week and a half. And so that experience for us has told us a lot that patients actually want to talk to something that'll help them get the information they want.
Han?
Repeat the question one more time for me.
Best practice and usage of data, whether it be organizationally, whether it be on the LLM level.
Yeah, I think for me, and again, I think the answer depends on where you sit, but for me, as I really focus on the 4 pillars of wellness: sleep, nutrition, activity, and stress, and the lifestyles, because fundamentally, we think if we do that right, healthcare changes dramatically. But you have to make it simple. And so part of my best practice is not just telling them how well you slept or how active you've been, but how you holistically are doing in the context of the day, and then nudge them so that they find it easy to do the right thing.
Deb, one of the best practices, I was at the Dubai AI Festival just last week, and one of the thematics coming out was transparency in your usage of data.
I think the question, that comment and the question that you're asking around sort of like who to watch and who are doing good things and data transparency and consent and privacy. Like, look, I think you have to just, it's not rocket science. It's actually just pretty simple. Let people know what you're going to do with their data and ask them if it's okay. I'm being really reductionist about it, but I think we don't give consumers enough credit for being educated about their health. Like, I think and I'm not suggesting that I understand everything I need to know about my genome, okay? But I do understand how I feel. And I think Han's bringing up a really important point about how we in our everyday life think about how we're doing and how that links to the actual data that is reflecting in some way how we are actually doing from a clinical standpoint, right? And so when I hear you ask the question, like, who's doing this well, one of the entities that comes to mind to watch, I think, is an organization in the UK that's launched called Our Future Health. And Our Future Health is seeking to build a 5 million person strong, essentially everyday research cohort. And they are doing the things that we are talking about right now, where you're having a constant conversation through digital technology back and forth with, this entity, the Our Future Health program, that involves the NHS and all of your electronic health record data in the NHS, along with other information about you and biomarkers and testing that is going on about you over time. But again, annotated by the contextual information of what I'm saying as the person in that study in terms of my day-to-day life.
Right.
And I think that's a program to watch because they're doing it at very large scale. They're doing it in a single record system, right, with the NHS. So if they can do this, I think it sets a model for how this kind of more holistic, day-to-day, constant cohort communication, for lack of a better way of putting it, in the context of health can be done.
Everybody's feverishly writing that down right now, and we'll Google it later. David?
So I think it's a little simpler. I think you just got to be helpful. And when I had the opportunity to lead Google's health, they would show this slide at Google, and I don't remember it exactly, but it was something like 11 products in the world have 1 billion users each. And then they go to the next slide, and it's like, and 7 of them belong to Google. And they're, YouTube and search and Android and maps and photos and whatever. And just think about how much information you give Google when you say, I'm leaving here tonight and I need to get to this restaurant in Beverly Hills. You're telling them who you are, where you're going, and then they know everywhere but what do you get in return? You get so much value. You get so much helpfulness. They tell me I'm going to be there in 4 minutes. It's almost exactly right. They tell me in 100 feet to turn left. I give them all my pictures, but they help organize them for me, and I can find whatever I'm looking for. What we're trying to do is to have that same philosophy. You're giving us, and I would say something actually more intimate than where you're going to dinner and your photos, you're giving us your health information. What we have to do in return is give you so much more value, that's so much more helpful, that overrides what you just gave us, and I think then people keep contributing their data because they're winning. And I think that that's the problem we have, is we don't think often about how can we help you. You just gave us something. I want to give way more back to you and help you navigate your breast cancer journey in the same way Google helps me or Maps or whoever helps me navigate getting from here to there.
Yeah, I totally hear what you're saying. Third bucket, and this is a jump ball for the 4 of you, commercialization of data. I'm always very interested. So, what's the value of X, right? And what is X? And all the way to the strategic level of how do I bring this to market? Who wants to go? Jump ball.
I think the most sustainable business models that we've seen in the last several years of, let's look at the real world data, real world evidence space, where huge de-identified data sets are being used in the post-approval setting to determine what's working for whom after drug approval, as an example. We're also seeing those same examples where there are direct connections to people to produce all kinds of information about how those drugs are working outside of the context of the EHR, and then linking in information with that context from the EHR. I think we are in a moment where that kind of linkage and that kind of information is telling us things that we didn't know. But back to something David said, if we don't make it information for people on the ground and for physicians and clinicians on the ground, what have we done? What have we done? We've perhaps justified drug pricing, maybe, or justified label expansion, but I want to make sure that we wrap it back to something David said, which is we have to actually just help people. And if we align incentives through that currency of trust and helping people, I think we'll be amazed at what data can produce.
Yeah, I like to say it's not my data. The data doesn't belong to our company. It really doesn't even belong to our providers. It belongs to the patients and the members in the community. Yeah. And it does have value. So in a de-identified way, we do it and others in the space do it really well. It can help speed up discovery. We can use real-world evidence to come up with things. We can go bench to bedside and bedside to bench. So there's all kinds of business opportunities there. But we shouldn't forget who gave us the data and how they need to be respected and thought of in this process.
Yeah, I know as a journalist, this is what we do. When we're in war correspondency or in conflict correspondency, if you come over and tell me your story, why are you going to tell me your story? And for us, it is we must own it and we must carry through with it as far as we can take that story. And you're saying the same with the data that people give you. Still the jump ball.
I love the answer that he just gave. We haven't sold data in that way. We get paid for the work we do, and I think that brings even more trust and confidence in the people we serve, which predominantly are probably underserved people, which cost our healthcare systems the most amount of money.
What do you value the data at?
Don't know. We haven't tried to sell it, so it's hard for us to know. What we know it's valuable, if you're talking about monetary value, that's what I'm saying, I don't know. In terms of being able to help patients, it's extraordinarily useful if they trust us. So we can help them make better decisions, we can help do things, everything up to the line of not being a medical device, and the AI piece has shown that to be extraordinarily useful for patients inside of their patient portal, which is HIPAA compliant, so they can actually get a sense of how to utilize the information. So we have more use cases in the last year and a half of launching the AI than we had in the 8 years prior.
Is it a question you ever discuss internally with your leadership team? What is the value of our data?
We do. We have an incredible team of people who actually care deeply about patients, and we're not a big team like a lot of the folks on stage. And so we talk about it a little bit, but what we always come back to is how does it actually help a person, a single person? And those are the right product decisions for us and monetary.
Han?
I hate it when David always answers, he gives the right answer, and so I'm just left with whatever I can make up. But in all seriousness, I think on the commercialization front, I want to echo what David said, which is Samsung fundamentally believes that the data belongs to the patient and the consumer. Exclamation mark. But from a commercialization, I would love, and we are pushing for data liquidity in which it becomes a utility where the grid between the consumer side and the healthcare side blends and it's communicating freely. That's the world we believe creates value for both the hospital system, the consumers, and the partners that are trying to deliver services. And we believe that there's a way in which we can, if data becomes liquid and a platform is created around the care that is delivered outside the home, and figure out a way to deliver context in the right setting back and forth. So for example, as we think about creating all the data from our devices and the appliances or TV, smart things, wearables, all of that data is not ours. We make that available to the innovators that will consume that data, will pass that data on to the providers and other innovators that will come together. If we're able to do that, which is really our push, we think we create the right construct by which monetization will occur separately. We're not necessarily looking at data commoditization.
We now have some questions or comments. I'll just read them, and some of them I can't read. It's cut off a little bit here. When 23andMe declared bankruptcy, there was a big media push to delete our data. In doing so, what does that mean to ourselves as well as to society? Who would like to answer that?
I deleted mine.
What'd you say?
I deleted mine off of 23andMe, and someone else that I had some other test I had done on behalf of a friend that wanted me to do it. Didn't know where my data went. The company got sold multiple times, figured it out, trying to get it. But in that case, that was one of my instincts.
I think there's actually a story that was either yesterday or today, since we've been here, that the proposal is now to essentially put it into almost like a data receivership while they go through the process of what's next in terms of the ownership embodiment for 23andMe. So I think it's actually a really, really interesting moment to watch this, and I think we should all be watching this very carefully.
Yeah, thank you for that comment. Also building on that very topic space, this says, well, as you look at trust, in which all four of you had given your very well-informed perspectives on, stories like this, though, do affect how corporates and businesses handle that. What might be your thoughts around the best way to break down that problem and then address it straight on? Han.
That's a tough question.
I know, nobody was talking, so I had to call somebody out.
So I think it goes back to each organization has a responsibility to be transparent and make sure that we continue to do those things in a way that adds value. And if we do those simple things, that we're transparent about it and we continue to build value for the consumer, they will give back in ways that David and others have talked about. That will naturally happen. And so, as I think about 23andMe, in the initial days, I was just amazed by how willing the patients were willing to share the data in ways that I didn't expect. So this is a story that went awry, but this is in the execution. The story went awry, but I think we need to go back to the core of the question of trust, and that is, I think if we really keep focus on why we're doing this, for whom, and if we keep that in mind, I think the rest works out. And so for me, I don't know that I have a magic answer as to what are the 1, 2, 3 things, and all of a sudden everything goes right. I think as long as you have humans in the mix, things go awry.
Yeah, when we have complex stories, we'll break it down, right? And this can both be a very complex issue and a very simple issue at the same time. And it depends how you want to address it. But it was breaking down exactly what happened here, a good way to communicate corporately. I mean, you're talking to the board, this is how we're going to handle this, this is this crisis, this is the way we're going to do it, let's break it down, and now communicate. We have to educate, basically.
This is maybe not exactly what you're looking for, but we think it's low-hanging fruit. Don't screw people over. And I don't think there's an industry where patients or people are more screwed over than in healthcare. I still am not sure how I get charged by my insurance company. I really have no idea, and I should know a lot of these kinds of things. Finance is also a little opaque, where you're not really sure what's going on. So if you start with low-hanging fruit, which is everyone agrees should be the thing, but it isn't, because of you got to follow the money, and the money is in the data that we don't know is being shared, or we know is being shared. Like you said, you have a 40-page consent. Are you not going to sign it when you get to the hospital? You have no choice. So you sign all of that thing that comes along. So the low-hanging fruit part is that, and the big thing that I think we're actually missing completely. We no longer have to ask permission to understand what our data means and whatever we put in that. That's what's changed with AI. You no longer need to ask permission, which is the lab coat. A lot of cases, it's can I even get my data? We have more access to our data, and it's not like you want all of your data for fun to look at it all. If you have something severe, yes, but generally you just want to know if you're okay or not, and especially in moments where you're most anxious. Sometimes you have your data test results to do that and understand. Sometimes you just have a question, and you want to talk to someone back and forth on it. So we view it a little bit differently.
Anybody else on the panel? All right, moving on to the next comment. What's the patient experience in a decade? How will healthcare and data and AI evolve?
I'll take a shot at that one. I think in 5 years, this AI will make our current system that you just described that's so broken much better. Right? I think we will achieve Han's vision, and we'll have connected the consumer and the clinical, and it'll be just jamming. It'll be spectacular. But in 10 years, I think we'll be fundamentally different. I think what we're seeing in quantum computing is that we'll start thinking about disease in a very different way. I don't think we'll be talking about Alzheimer's, and I don't think we'll be talking about depression. I think these things will be understood, because I think what AI has done for language in natural language processing, quantum computing is going to do for biology. So now we're going to really understand biology, and I think we'll have a complete different concept of what it means to be sick and how to intervene. You won't go to a liver doctor or to a heart doctor or to a psychiatrist, right? I think it'll be the same inflection that we've seen with language. Because of AI, especially Gen AI, quantum is going to give us that inflection around biology, and I think that will change healthcare dramatically.
I was reading Byte magazine the other day. It's from 1981, and on the cover is a smartwatch. So I hope you're right, especially in the role you're in, that'll end up being the case. I think it'll end up being a lot of regulatory issues that will be controlled by lobbyists who end up wanting to make sure that people are still getting paid for the things they're doing. And if those things are somewhat removed and there's more ability to do things without permission, like I mentioned, I think you'll see a more empowered population. We spend, $5 trillion on healthcare in the US? It's a quarter of our GDP, quarter of the cost we have. And so I absolutely hope, and I think it's going that way. I just think we're going to rely less and less on the people that are experts, and people will take it in their own hands, especially when insurance is expensive, and especially if they don't have time to go to the doctor or it doesn't fit their criteria. I think you're going to see a massive hit on the two of those. Overall, we're absolutely optimistic it'll do more, but we think a lot of it has to be without permission. So you can do more with your own information the way you want, and we're already seeing people do that by the millions.
You know, Deb and Han, which sectors within the healthcare industry do you think will benefit the most in this 10 years? Will it be pharma? Will it be those wearables that we were talking about earlier? Which sector will benefit most from data and AI 10 years from now? You're saying fundamentally different, David. And to the two of you, Deb, why don't you go first?
Well, in the case of class 3 implantables, we have to realize that these systems, many of which have been around for decades now, were designed to operate as closed systems. In other words, the original pacemakers, and even pacemakers now, that the only data sort of release they have is that data that's going into remote monitoring systems between me and my physician. And that's not even all of them, but they all have that capability. They weren't open systems to allow the merging of other types of information or other types of data, to the distinction that David's making, to be able to be used in the delivery or optimization of therapy. And I think that multimodal health data is going to be integrated into medtech in a way that we could not have imagined 20 years ago. And it's going to create, I think ultimately it's going to create more power in terms of performance. I think it's going to create more precision in terms of the tunability of my therapy or my therapy delivery to be tuned to me. And I think in the case of systems like robotic surgery, you're going to see amazing things happen because of the entrance of new types of information and data. We will be doing remote telesurgery. It's happening in India right now. And so we will be able to do things because of the information merging or the data merging into AI-layered systems that we really can't kind of imagine right now.
What does multimodal look like in 10 years?
Yeah, that's a great question. I think, let me get back to the robotic surgery example. I think and I don't think it's 10 years away. I mean, I think the multimodal example in that situation is the response that I as a physician, not that I'm a physician, but if I were, the response that I am having to real-time haptic feedback that is coming into me, right, into my controls as I'm doing robotic surgery. The visual information that I'm choosing to look at or not, that may be color-coded or real-time assist, that's allowing me, again, to integrate what I'm seeing with what information is coming to me from the smart system, combined with an entire networked AI layer across many robotic surgery systems that is real-time learning from patients like the one I'm operating on, or physicians like me in the same context, or just general learning that's occurring with regard to protocols and OR protocols and surgical technique. I mean, that's real, and that's going to happen. It's happening now, but it's going to happen at the level we're talking about within this next decade.
It's a great question from the audience, again, as we're going through these at the moment. We've got about 2 minutes left. Han, react to that. What does multimodal look like? What does it look like in general in 10 years?
Yeah, I'm going to try to simplify it. We have the 5 senses, right? And so
last time I checked, yes.
5 senses, and then AI is the 6th sense to me. So imagine adding AR glasses or VR glasses, and you've now added this multimodal data to the additional data, ambient sensing to that. And so think about 5 senses fully empowered, the 6th sense, which is the AI that brings that together in ways that have never been done before. I think that's where we're headed. But I think most importantly, I would say, I hope, if I'm right, not only will have advances in genomics and all this multimodal data, but that it brings back humanity, that we have the capacity to care for themselves and others. We can't not focus on that, because sometimes we think a lot about data privacy and all those things, but fundamentally, we have to make sure that we're here for each other and care for one another.
To all of you now, and if you could stick to the 30 seconds, this is our last round. The lights are blinking up here. We're gathered here to talk about unlocking health data, and that all four of you have done such a great job of staying right on that topic. When I walk away from this conversation with all four of you later on, how should I be expressing how to unlock health data? What is your advice to me to discuss that? And I'm just going to go opposite of the way we started our panel. So we'll go with Han, and we'll just make our way down to the left.
Yeah, I think I think unlocking the data really means, for me, going back to the doctor and patient relationship, bring that back in ways the Dr. Marcus Welby days. If we can do that through technology, then I think we have something.
Thank you. Deb?
I think if you're, no matter what kind of organization you are, but if you are involved with or holding data that is related to the health of people, and you want to know how to use it, just ask them. Just ask them. And they'll give you a lot of really good ideas.
Carefully. That's my one answer.
Oh, I love that. So you're all working off of each other on this. Yeah. And finally, Raman.
Use AI to figure it out. It's already unlocked. That's it. Just if you're not using AI to help in your own health, you're absolutely missing it.
Big round of applause to Raman, David, Deb, and Han. Thank you so much.